So I'm Chris McDermott. I'm a consultant neurologist in Sheffield. I'm co-director of the MND Research Centre there. And so I provide day-to-day care for people with motor neuron disease living in the South Yorkshire, North Derbyshire, North Lincolnshire area. I also run a large research program, and my research program is focused on trying to find effective treatments for patients with motor neuron disease. So we do a lot of clinical trials of oral drug compounds, but also more recently some gene therapies. The other focus of my research is trying to ensure that whilst finding a cure and better treatments is paramount, and we must do that, we have to also think of people living with motor neuron disease now and make sure that those living with motor neuron disease now get the best evidence-based care possible. It struck me that a lot of the day-to-day things we do to support people with motor neuron disease, the symptoms that they suffer with on a day-to-day basis, the evidence around how best to deal with them was just sort of made up. It was expert opinion rather than strongly evidence-based. And it struck me, well, now I'm the expert and I don't really know, and that doesn't seem right. So we've gone about in collaboration, with other colleagues around the country, developing the evidence base to provide better care. So that's the sort of what I do. So I'm looking after patients, I'm running research programs, and doing my best for people with MND, working as part of a very large team, both locally, but collaborating nationally and internationally with other researchers and neurologists and patient organizations to accelerate us towards a cure for MND. So that's a challenging question, Stephen. It is hard. You would always rather not have to give that diagnosis, and so before giving the diagnosis, I need to be sure, because it has life-changing implications. So you have to gather the facts, be sure, and then make that decision that you're going to tell somebody that they do have motor neuron disease. I think it takes it does take a toll. It's different. So I would say it's never easy, and then randomly at times, and I find it hard to predict. It just happens to me sometimes that I struggle so much in a diagnostic consultation that if I can get upset as well, with the patient getting upset, and I think that teaches us that it is hard, and you can never do it as it's a routine. Telling each person is it's a life-changing day for them, and I think you're always aware of that. You try and stay professional, but sometimes you have to just accept that it's a very emotional situation, and it's hard to predict how it emotionally affects you. I think it's important within the healthcare professional team that you have others that you can talk to, and I have a good network of support within my team, but also I talk to colleagues around the country who do this, and it's reassuring to know that I'm not different. The way that it affects me is how it affects other people. So that was quite a long-winded answer. I apologize. It was a very, very difficult thing to talk about. I was doing a ward round. I was preparing for a ward round, and the consultant neurologist I was going to have to present the cases of the individuals that were admitted. And the patient obviously wanted to know what the results of the tests were, what was going on. And just on that ward round, in an open ward with all the people around, they were told that they had motor neuron disease, which didn't seem right to me, that sort of just being told like that. They weren't really told much about it. And when the patient then asked a few follow-on questions, they were told, oh, your GP will sort it out. And they just, were discharged to the GP. And I remember at that time thinking that doesn't seem right. And this individual who I'd had a lot of admiration for, they were quite inspirational in many other ways. I was shocked at how uncomfortable they were in giving the diagnosis and dealing with MND, and they just wanted to sort of it not be something that they were going to deal with and pass it on. And if you think that a GP will see about one case, an average GP will see one case in their career, they're not going to be an expert. And that just seemed wrong to me. And it was following that I thought, well, if we're not going to own this as neurologists and support people with this condition, motor neuron disease, then who is? And that's when I sought out Professor Shaw, and I went to work with Professor Shaw in Newcastle and began my training in motor neuron disease. And it's something that I will never forget. They were a great neurologist, but they were very uncomfortable. And you do see that. You see people shy away from dealing with, telling people that they've got motor neuron disease and supporting people to live with motor neuron disease. But I've always felt, even though it's hard, someone has to support people to get the most out of life with motor neuron disease and be honest with them. And that's part of being a doctor, really. So there's no doubt there's been huge advances in our understanding of just the basic biology, what's going wrong in the neurons. So just one example how science is evolving. We now know that there are TDP43 inclusions, and we now know that RNA metabolism, so how genes are converted into proteins, and all that process is a key central mechanism within motor neuron disease. And that wasn't, if you Googled or done a medical online literature search around RNA metabolism and motor neuron disease 10, 15 years ago, you'd have had hardly any hits. Now there'd be tens of thousands of papers. The whole sort of area is focused. So you just get a sense we're looking at the right area now. We're targeting the right pathways with the drugs that are coming through. Progress has been slow, though, and I think progress has been slow because it's underfunded, and there's no doubt. Pour money into a problem, you can solve it. You put enough people on the problem, give the appropriate level of funding, you make huge changes. If the step changes that have been made in motor neuron disease, a lot of them came with big injections of cash. So the Ice Bucket Challenge, led to discovery of key new genes, really advanced the field. So money is important. And at the moment, I've heard a quote that MND is not incurable, it's just underfunded. And I think there's something in that. Very grateful, and I can honestly say that probably all the research that I've been involved with has been based on donations, charitable funding. I've had several things that I've done that wouldn't have happened if we'd not initially been supported through donations, through foundations, or sometimes even personal donations to our department. It makes a huge difference. A huge difference, yes.